Good evening, everyone. My name is Jenna Garber. This summer, I interned with the International Hospital for Children, which is a nonprofit here in Richmond. The name is relatively misleading. It's not an actual hospital, but what we do is we link pediatric health care that we have access to here in the United States to our 6 partner countries in Latin America and the Caribbean. And that involves 2 programs, the We Send program, which sends surgical teams to Latin America and the Caribbean all year long, and also the We Bring program, which brings children from those countries to Richmond to receive surgeries that they couldn't otherwise receive. I am going to play a video, which is what Adrian is getting ready. This was a video I created for my final project, something I'm really proud of. It highlights the IHC office and the staff and what personally motivates them to do the work that they do, and also why IHC exists and what inequalities it's addressing. And before we press play, I just want to say one important thing that I think is just incredible, that all of the photography and videography in this video belongs to the International Hospital for Children, and these aren't images that I just get off the internet. They are taken by the volunteer photographers that travel occasionally with these surgical teams down to Latin America and the Caribbean. So I hope you enjoy it. There is sound. Mm-hmm.
care to these children without IHC's help.
I think within popular culture and within the news media of the United States, we feel that there are problems with our healthcare system. They truly pale in comparison to the issues that most of the world's population are facing when they're trying to reach or have access to basic care, or especially if they have higher level needs.
I really strongly believe in IHC's commitment to sustainability in our partner countries.
I would say primarily it would be a faith-based calling to serve other people that need our help with love and compassion, and wanting them to have access to the kind of care that we want for ourselves and for our children and families.
We have a great mission. We have a great mission. I tell everybody, how can anyone not love what we do?
Most importantly, donations that are made to IHC have a direct and immediate impact on children's lives. And to me, that's so important. And all the proceeds are benefiting children every day. It's just amazing.
I found myself desiring more to be a part of empowering communities in Latin America. And in my mind, IHC is doing that by increasing their capacity to care for children.
I heard it and instantly thought, okay, what could be better to spend my time doing this summer?
You get to see hands-on what you're working for. You get to interact directly with the kids, with the staff in our partner countries. So you get to see in real time what you're working for, and that keeps you motivated to do the job that we're going to do.
Seeing the family from start to finish, from their arrival in Richmond to their successful surgery and the quick recovery, and then to see them going home healthier than when they came is really the most rewarding part of what I've done this summer.
It's very gratifying for me to have my livelihood to bring philanthropy and good works together with one another to really make a lasting difference in the world.
Being able to help IHC put together the corporate infrastructure to enable us to become a stronger and better organization. It's a real appeal and challenge.
IHC's commitment to sustainable capacity building and training of local healthcare professionals is something that really sets us apart from other organizations working in the same industry of Michigan or overseas. So I really respect that, and I think that just goes a long way in the long term.
Through my work with the children that I meet, I actually have realized that what really energizes me is being able to interact with and develop relationships with the families that I work with.
You know, I guess you look at it three ways. That number one, we're all God's children, so everybody should have access to the care. You know, number two, it's a human right that you have access to health care. As a matter of fact, it's Article 24 of the rights of the child, that you should have access to quality health care. And then number three, because we can, you know, we've got the doctors out there and we have the hospitals out there that truly want to do this. And it just takes an organization like International Hospital for Children to efficiently link those volunteers and those medical resources to the children in those countries and the medical people in those countries to really make it work.
Just a few last words. I wanted to thank Tracy Stuck, my supervisor, who's here tonight, Dr. Williamson, Cassie Price and the CCE, and especially to the Marsh family for making this summer possible. I learned a ton, and I look forward to answering your questions. Thank you.